Hi. So I wanted to just take a few minutes to explain a little bit about what to expect in the first session. Often going into therapy is like the hardest part. Walking in there and telling somebody that you've never met your most vulnerable moments is scary. And so I'm hopeful that this video can at least take the edge off of some of the anxiety, at least knowing what to expect. So the first thing that you should know about an intake appointment is that they're different than what you'll expect from there on out. One of the differences is that it's a little bit longer. So typically for an intake appointment, I'll block off 90 minutes. So we'll meet maybe 80 to 85 minutes. And regular sessions are 50 to 55 minutes, and we'll block off an hour. And it's a little bit longer so that we can have enough time for you to settle in and feel a little bit more comfortable. It gives us a little bit extra time for all the nosy questions that I have to ask about your history that may or may not feel easy to talk about. And it gives us some time to talk about treatment options. So what do you want to work on? What are some ideas that I might have about how we'll get there? And we can talk about how long therapy might take and all of that good stuff. So I did mention the nosy questions, and I wanted to explain a little bit about that because there's just no getting around it. I have to ask hard questions in that first session so that I can have a little bit better sense of what it is that you're bringing to the table and what your life has brought to the table and what we might need to work on. With that said, there is nothing that means that you have to talk to me about the questions that I'm asking. It is absolutely 100% okay, and in fact I encourage people to tell me if you're not ready to talk about it. Just say, I'm not ready to talk about it. If you don't know right now, that's okay too. And if you need to take a step back from whatever the topic is, because if it's overwhelming or you feel nothing at all and you're going to feel feelings about it later, then I'd rather you let me know that, and either we don't talk about it right then, or you tell me just the headline and not the full story, not all the details of the memory. And this can oftentimes make that memory just feel a little bit more tolerable in that first session. So that's basically it. Obviously, we'll talk about confidentiality, answer any questions about payment or scheduling, get you oriented to the office and where the bathroom is and all that good stuff. But yeah, that's the first session in a nutshell. So I'd love to answer any questions that you might have. Feel free to text or email or give me a call. My number and contact information is at the bottom of the screen. But thanks for taking the time to find out a little bit about that first session. Take care.